Hello, everyone, and thanks for listening. So, basically, basically, what you're seeing is yet another one of these articles, but this one is a lot serious. It gives more data, more of an idea or a general picture as to where we're at now in terms of the coronavirus pandemic and the numbers that are projected in terms of trajectory of how many people will outlast and how many people, unfortunately, will possibly, the numbers of people that will die. A new report warns that the coronavirus pandemic will overwhelm the U.S. hospitals and kill 81,000 people by July. And so I'm just going to run a rough estimate right here. So it says 81 people by the end of July. We're at 24,000 people that have died so far in the U.S. Based on what I saw earlier. There's like this when you go on your front page of your social media, whatever search engine you're on or whatever. If it's Yahoo, if it's MSN, and it'll give you like a an large number of people who have contracted it, and then it'll give you the numbers of people that have succumbed to this deadly virus thus far. And so this report does not look good. And so I just want to warn you that I'm going to tell you what I saw in this. It was really alarming. So 24,000 that have already succumbed to this virus, in other words, have died. So they predict that 81,000 more people by the end of July. And I believe this is why a lot of people or a lot of lawmakers that are in opposition with Donald Trump's idea of starting up the American society going back to work on April 12th is too soon. Because if we start to relax on the rules of social distancing, if we start to get relaxed and go back to our normal lives as if this disease is not even out there, then it's predicted that between 38,000 and 162,000 more people will die by the end of July. And so that's even before we even go back April 12th. And so that's even before and then even after April 12th. That's the numbers that they come up with. And then in terms of like 38,000 more people by the end, and then 162,000 by the end of July, possibly. That's the higher number, the higher end of it. But what's scarier is by the end of the year, it's projected that between 200,000 and 2.2 million by the end of the year will have died of this coronavirus. And so let me read the article so that you'll see what I'm saying. So it doesn't look like or sound like it's just numbers coming from me. And so U.S. coronavirus deaths could reach 81,000 by July, even with current social distancing measures in place, according to the new report from the researchers at the University of Washington. So some hospitals could run out of ventilators and intensive care unit beds as early as mid-April, the report has projected. And so, however, the researchers said that the initial wave of COVID-19 pandemic could end by the summer if the country stays on lockdown. And so the trajectory of the pandemic will change. So dramatically for the worst is what they're looking at, not the better. So if people ease up on social distancing and relax with other precautions, the researchers have warned the coronavirus pandemic could claim 81,000 lives in the U.S. by July and overwhelm hospitals by mid-April, according to a new report from the Institute for Health Metrics and Evaluation. And so the University of Washington School of Medicine, that's very, very alarming, and it gets worse. So the demand for ventilators and beds in the U.S. hospitals' intensive care units, which are ICUs, will far exceed capacity for the COVID-19 patients as early as the second week of April. And so that's what I was saying. If we go back to our normal lives as if this virus is over with and start back the economy, and people go back to doing what they normally do, even if they do the social distancing, even if they don't ease up, deaths related to the current wave of COVID-19 in the U.S. are likely to persist in all well into July. So the IMHE researchers said in a statement on Thursday. So as the number of COVID-19 virus patients spikes, an outcome that public health experts say is all but certain. So 21 states could need more ICU beds than they have currently, while 12 states may need to increase capacity by at least 50%, the report is predicted. So the IMHE's estimates are based on information from a range of sources, including local and national governments, the WHO, the World Health Organization, and the American Hospital Association also assume that the U.S. works diligently to limit the spread of the virus through social distancing and other measures. Possible spread of COVID with and without protective measures. Without protective measures, you see a graph, the health care system capacity with protective measures. And so that's the time since the first case, and so that's how it's looked. And so it basically doesn't show any signs of slowing down unless people pretty much isolate themselves. So the trajectory of the pandemic will change dramatically for the worse if people ease up on social distancing and relax with precautions. We encourage everyone to adhere to those precautions to help save lives, said IMHE Director Dr. Christopher Murray. So IMHE acknowledged that there's a lot of uncertainty in the estimates. The number of U.S. deaths could range between, this is the number, 38,000 and 162,000 by July, the group has said. And so that's the grim numbers. Other researchers have predicted anywhere from 200,000 to 2.2 million deaths in the U.S. by the end of this year. So earlier this week, President Donald Trump, he broke the prevailing public health guidelines by calling again for Americans to return to work as soon as possible to restart the struggling economy. The U.S. continues to hunker down. The current wave of the pandemic could end, meaning fewer than 10 deaths per day nationwide, IMHE's release said. But we hope the forecast will help leaders of medical systems figure out innovative ways to deliver high-quality care to those who will need their services in the coming weeks, Murray said. And so I just wanted to say there's a doctor, I believe his name is Fossey, and he said people do not make the timeline. The virus makes the timeline. And I believe he said that because he was forewarning of these numbers. Just outright, he already knows that you cannot predict when's the best time for people to go back to work with a virus like this. It is very deadly. It's very highly contagious. and you don't know where it is. It could be from an article I read, and I hate to make it sound very scary, but I believe it should be that people will take it more seriously. That you could even be tracking it on your shoes and bringing it in your house. If you're in an area that's contaminated with this virus, because it can live on surfaces for a number of hours to a number of days. And so it is very highly contagious. It is very easily spread person to person. Even without another person giving it to you, if they've left that virus on a surface and it's there, it's basically waiting for a host to infect, and then you then carry it to your family members. So that's why when one person is quarantined and they are moved away from their family, so they're quarantined not only away from their work colleagues, but also their family members. And so, anyway, with having said this, I'm gonna end this video. It's very short, and so this is what's going on right here. So that is the reason why they're giving this trajectory of numbers. And I don't know if you've seen recently that Donald Trump was saying that, oh, we need to start the economy back up and we need to open up America's jobs, and we have a struggling economy and we can't shut down the American jobs for the whole year. I don't believe they were saying shut everything down for the whole year. I believe they were saying shut it down for 8 to 10 more weeks, at least to give people a fighting chance, so that maybe it will lessen the numbers of people that come in contact with it. It may even subside even. I also heard possibly there might be another wave of this virus that will come back in the winter, because it seems to do thrive a lot more during the colder seasons or the colder climate. I was looking, it was saying that in hotter climates it's not as successful. So that might explain why some of the numbers may be low in some countries that are closer to the equators, but that doesn't mean people still can't get it. A lot of people are dying, and a lot more people are dying is what this is saying, or what it's projected. And so it's basically a lot of hand washing, a lot of precautions, a lot of distancing yourself away, like I believe not 3 feet but 6 feet away. And just try to keep yourself safe as possible. Some people will come in contact with it and have a milder case, but even with the mild cases I'm hearing, you still could be on your back in the bed, really, really ill. And so it's nothing to take lightly. And so it's like you're gambling, playing Russian roulette with your life. Every day with this virus out there, you don't know where it is. It's like a silent thing that, some people are getting on here saying, oh, I had this and I had this mild case, I didn't have any symptoms. But that doesn't mean everybody has the same body and they have the same issues. Some people have health issues. Some people don't know that they have health issues, and you don't want to go out there and get this virus and find out. And so, and then I've heard some people who said that they weren't asymptomatic. They were healthy, and when they got the virus, that they still were very, very ill. So it's like I said, you're playing Russian roulette if you go out there and you try to pretend like this is not that big of a deal. And some people still think it's funny. They think it's a hoax, and they don't believe it. And there's still some people that are laughing and joking about it, and they take it lightly, or they think maybe they can use religion to pray this away. And I'm not trying to be offensive, but you don't want to play Russian roulette with your life and get out there and then you come in contact with this disease and you learn something otherwise the hard way. So that's what I've been hearing from a lot of individuals who have come in contact with it, or who have you know, ended up with it that even with the milder symptoms, it hasn't been that easy for everyone, unfortunately. So having said that, I'm going to let this video go. It's just about staying safe. I don't know. What do you think? Do you think it's the safest thing to go back to work April 12th? Some people are at work because they work at places that have essential needs for people, like, like CVS, Walgreens, Rite Aid, and some of the pharmacies and places like that, and the hospitals, of course. But like some of the regular places of employment that aren't essential jobs, is it just a recipe for disaster? We shall see. I don't know if that's going to be possible to start everything back up this easy, but I do know that when people do decide to go back, even if we do wait a little longer, I don't think the world is ever going to be the same completely after this virus. When people are able to finally feel some level of comfort in going back to their places of employment. And who knows, it may even take a lot longer than what we expect before we can ever recover from this. Having said that, thanks for listening. Stay safe.